So, on the 21st of February there was a meeting in the surgery behind me of the PPG network, and that's effectively having representatives from each of the PPGs. That's the Grove, Howard House, the Haven and Walton surgery, discussing various things or being updated by various parts of the health delivery services as to what changes may be coming down the pipeline towards us. And this meeting kicked off with the East Suffolk and North Essex NHS Foundation Trust. To you and me, that is the merger between Ipswich Hospital and Colchester Hospital, and covering a much bigger area, and where they're looking to be heading in the future. And what they are working on is a draft strategy called Framing Our Future, and it's the philosophy is times matter and a future model of care. Various bits and bobs within that document. Young Bernard will actually load this up on our system so that you can see what it is, but that really is the key diagram. What it shows is the home and the patient, where you are in the centre of this, and then concentric rings go out as the level of support or care that you need becomes more building based, more professional, etc., etc. I came in halfway through this presentation, so to do them justice, I don't want to say that it wasn't whatever, but it seems to have a lot of missing bits within it, and it seems to have been put together specifically purely on the hospital rather than the patient, because what you would want to know is where you would need to go for a mental health problem or care. It's sort of only a part of the story, and though they're showing concentric circles, most of the experience, I think, finds silos between different organisations, and it's actually getting into those. And the worst one currently for us, I think, is mental health. Then that moved on in this building to a new subject, and that is social prescribing. And you may have read something or heard about it, or what is it and what does it do. And basically, it's often in life you don't really need pills, you don't necessarily need a stay in a hospital or whatever. What you do need is some support moving towards an activity that might actually perhaps suggest a measure of loneliness or lack of activity or lack of physical activity, etc. And that sort of is getting this nice big description as social prescribing. So we'll put this up on our site so you can see basically the areas that are being discussed. And this is, it's okay, so social prescribing, how do you actually get to it? When you go to see your doctor, what will he be doing, etc. So they are working on how this will all interconnect, and there are quite a number of complex issues overlaying all of this. It's access of information on you, where how much and to whom and what, and is it safe and secure. So it's really a work in progress as far as I could see, and the bit is going to require a community advisor. And now, whether it means we're going to have a whole rack of more bureaucracy to deliver what seems to be a good simple idea that would be a benefit to you and me is yet to be determined. So then the final subject on the agenda was what might or will be happening to our minor injuries unit. So I think we've spent enough time here at Walton Surgery, nice that it is, and the sun is great. So we'll decamp from here and move off to the existing MI unit.